of the dental hygiene students at Loma Linda University, and today we'll be talking to you about how to care for your child's oral health. Our learning objectives today are to learn about the proper way to care for your child's teeth. We will focus on teaching you about different ways to prevent childhood caries and fluorosis. We will also be talking about how caring for your child's oral health can improve their quality of life. Lastly, we'll be demonstrating proper ways to brush your child's teeth. Before we begin our lecture, we're going to go over some questions in order to test your current knowledge about your child's oral health. If you're having trouble answering any of the questions, watch the rest of the video and learn the correct answers. Number 1, do babies' teeth matter? Fact or fiction? Number 2, is early childhood caries a normal milestone for your child? Fact or fiction? Sharing utensils with your children is safe. Fact or fiction? Is fluoride harmful for my child? Fact or fiction? Do you take your baby to the dentist after their first tooth erupts? Fact or fiction? Many people think that babies' teeth don't matter because they're going to be replaced by their permanent teeth later. The truth is that babies' teeth are very important for several reasons. Baby teeth provide the fundamental foundation for permanent teeth. They act as placeholders for your permanent teeth. If your child loses their baby teeth too early, then there may not be room for their permanent teeth to come through. Baby teeth are also important in that they shape your child's face, and they help them to speak and chew their food properly. This picture shows the order that teeth erupt, so you can know what teeth will erupt first in your child's mouth. It also shows the age at which baby's teeth erupt and the age at which the children lose their teeth. Remember, these dates are just a guideline, so do not be alarmed if your child gets teeth early or late. If your child does not have any teeth by age 2, then it may be time to ask your dentist about it. What is early childhood caries? Caries is a term used in dentistry to describe cavities. Early childhood caries is a distinctive form of cavities that affect young children. It usually starts on the top front of their teeth and moves towards the back teeth. Be sure to check your child's teeth regularly for any white spots or dark areas appearing on their teeth. The sooner you can catch it, the sooner it can prevent conditions from getting worse.
It is very important to try to prevent early childhood caries before it starts. Your child is at risk as soon as their first tooth erupts. It is important to visit your dentist as soon as your child gets their first tooth. Before your child has teeth, you can wipe their gums with a damp cloth daily. Once your child gets their first tooth, it is important to brush their teeth twice daily with a half size of a pea amount of toothpaste. It is important to try to wean your child off the bottle by the end of their first year. By the time your child is 3 years old, they should be getting their yearly dental exams. It is also important to brush your child's teeth 2 times daily with a pea-sized amount of toothpaste. You may want to ask your dentist about getting sealants for your child. Sealants are a great way to prevent bacteria from getting into the deep grooves of the teeth, and this will help prevent cavities. Make sure your child is not drinking from a sippy cup all day long. Drinking juices and other acidic drinks all day long can weaken your child's enamel and make them more prone to cavities. If they want to sip on something all day, try to replace their juice with water. Remember to try not to share anything with saliva on it with your child, such as sharing utensils, drinks, or toothbrushes. Caries is a transmissible disease that you can pass to your child. This picture demonstrates the correct amount of toothpaste your child should brush with. From 0 to 2 years old, about a half of a pea size is the correct amount to use. From 3 to 6 years old, it is appropriate to use a pea-sized amount of toothpaste. We want to use a small amount of toothpaste because children are not able to rinse and spit out the toothpaste, so they end up swallowing it. and a large amount could be harmful to your child, and it could lead to fluorosis, which we will talk about later in the lecture.
The Fones technique is used primarily for children. It's also used for the patient that doesn't have the dexterity to use Bass or modified Bass technique. The toothbrush is taken and just used in a circular motion with the upper and lower teeth together. We go all the way around the buccal areas, the labial areas, both upper and lower together at the same time. For the linguals, we're going to do the same thing, just a circular motion. We'd have to do upper and lower separately. Again, in the anterior region, we're going to do the heel to toe motion. This again is for the patient that is lacking dexterity. For a child, once they have the dexterity to use Bass or modified Bass, we'll move them into that.
Ready? Open. What a good girl. Okay, don't chew on it. Open wide. Even though it is not always easy to brush a young child's teeth, it is important to get them used to the toothbrush and to get them into the habit of brushing regularly. Now we will talk a little bit about secondhand smoke. If you or a close family member smokes, your child may be at risk of being exposed to secondhand smoke. 1 hour of secondhand smoke is equivalent to smoking 4 cigarettes. It is important to make sure that no one is smoking around your child in order to make sure that they stay healthy. If your child is living in a home with someone who smokes, it is important to get them to stop smoking in order to protect your child. Children are very vulnerable to secondhand smoke. Exposure to secondhand smoke can cause your child to experience more ear infections, coughs and colds, respiratory problems, and tooth decay. Some long-term effects your child may have are poor lung development, lung cancer, heart disease, and cataracts. This is why it is very important to quit for yourself and your child. Now we will be talking about fluoride. Fluoride is very important for your child's oral health. Fluoride protects the teeth from acid damage and can help reverse early signs of decay. Make sure your child is drinking mainly tap water because tap water usually has fluoride in it. It is also very important to use toothpaste with fluoride in it in order to make sure your child is getting enough fluoride to protect their teeth.
Even though fluoride is very good for your child's teeth, too much fluoride as a young child can cause fluorosis. Fluorosis is hypomineralization of the tooth's enamel caused by too much fluoride used during tooth development. Fluorosis usually appears are white or brown spots on the surface of the tooth. In order to prevent fluorosis, it is important to use no more than the recommended pea-sized amount of toothpaste while your child's teeth are developing. We have learned today that baby teeth matter and are very important in helping your child eat and speak. We also discussed that early childhood caries is a transmissible but preventable disease. You also need to be mindful about how much toothpaste you are using in order to prevent fluorosis. We also learned about the Fones brushing technique for children. Children are more susceptible to secondhand smoke, and it is important to quit smoking for the safety of your child. And lastly, fluoride is very important for your child's oral health, and it can help prevent tooth decay. Here are the questions and answers from the beginning of the video. Number 1, do baby teeth matter? Fact or fiction? It was fact. Number 2, Is early childhood caries a normal milestone for your child? Fiction. Number 3, sharing utensils with your children is safe? Fiction. Number 4, is fluoride harmful for my child? Fiction. Number 5, do you take your baby to the dentist after their first tooth erupts? Fact. To reiterate, this image highlights some essentials for preventing tooth decay and having healthy oral care for your family. First and most importantly, do not share food or any body fluids such as saliva with your children. Even though it is very tempting to do the show, tell, do technique in tricking your child to eat something healthy, do not do this because remember, caries are transmissible. Secondly, by eating healthy, it will create a positive image for your child to eat healthy as well. Thirdly, remember to take your child to the dentist no later than their first tooth or first birthday. Fourthly, make sure to use fluoride toothpaste as soon as teeth come through the gums. When kids brush their own teeth, have them brush for 2 minutes two times a day. Last but not least, ask your dentist about applying dental sealants to chewing surfaces of teeth. Sealants are crucial for caries prevention by blocking areas susceptible to caries. Remember, these are just some essentials in preventing tooth decay. Here is an ideal timeline of healthy oral care that you can refer back to at any time in the future. This timeline demonstrates from the very first time you should take your child to the dentist at their first tooth or birthday. Next, from 1 to 2 years old, you will need to make sure you supplement your child with fluoride as needed. Ages 2 to 6, a cleaning with a toothbrush or with a Profi cup in conjunction with fluoride varnish or trace is recommended. After age of 6 years old, your child will require some scaling from your local friendly hygienist or dentist. At this point, it is crucial to set the standard to follow up with a recall, which after a normal cleaning would be in 6 months. Here are some websites that you can use to help you find free dental clinics in your area, and a website to help you or others around you to quit smoking. You can call 1-800-QUIT-NOW to ask about help when it comes to quitting smoking. Thank you.